Hi, I'm Judy Hart. Thank you for joining us for this short video presentation. I'll be explaining the billing and payment process for child care services which are processed through our computer system. When you are serving children who are eligible to receive child care subsidy from DHHS, there are some things you should know. To qualify for this assistance, the family must have at least one of the allowed needs for service: employment or actively seeking employment, participating in an activity of the Employment First Self-Sufficiency Contract, obtaining medical services from a physician, mental health provider, alcoholism treatment, health check and follow-up, or to obtain family planning services, or the family might be enrolled in and regularly attending a GED, high school English as a second language classes, vocational training, or pursuing an undergraduate degree. We do not authorize care for persons to obtain a second undergraduate degree or for getting a postgraduate degree. The parents might be participating in on-the-job training. There might be incapacitation, which has been verified by a doctor, or certain situations of abuse, neglect, or exploitation. Sometimes there are situations where a child is in foster care and the parents are receiving services aimed at returning the child to the home, or when care is needed for one child because the parent is taking another child to receive medical care or is visiting a child in the hospital. The social service worker assigned to the family determines eligibility for the family. Once the family is found eligible, the worker will notify you as the provider that the parent qualifies for assistance and the terms of the authorization. This will include approved dates, number of hours of child care approved, family fee, and any other important information. The billing and payment process begins with a service authorization. There are three different types: initial, update, and notice of discontinued service. The first authorization is the initial authorization sent to you when you are approved and begin to provide services to a family through the child care subsidy. It is named Provider Authorization. The second authorization is an updated authorization, which you will receive if there is a change in the family's eligibility during the authorization period. This is named Provider Authorization Update. This one. And finally, the third is called the Notice of Discontinued Service. You will receive this authorization if, for some reason, the service has ended before the end date on the original or updated authorization. If services are to end at the close of the authorization period, you will not receive any notice other than the original or updated authorization that shows the end date. These authorizations serve as the legal document that gives you permission to provide the specified service and bill the department for payment. It is very important that you have a current service authorization before you bill for child care services. Now, let's look at an initial authorization. Look at the upper left-hand corner and you'll find the name and address of the office that sent you this form. In this example, you can see this authorization came from the Lincoln office. Your completed billing needs to be mailed to the office address found here. In the right-hand corner, you'll see the office number. This number is for the Lincoln office, which is 135. Each local office will have its own number. You will need the correct number in order to complete your billing document. Below that is the name of the worker who authorized you to provide the service. In our example here, the worker was Calvin Hobbs. Under the worker name is the date of notice. This notice refers to the most current authorization. The mail date is the date this authorization was scheduled to be mailed to you. On the left-hand side of this form, you'll see the name of your business or your name. In our example, the provider's name is Mary Popkins. Below your name is your mailing address. The provider authorization will state the program being authorized. In this example, it is child care. Next, you will see your name or your business name, and below that, your telephone number. Across from your telephone number, you will find your provider ID. Now, the computer assigns this number. You will use this ID when billing. All authorizations will have the following legal statement. On behalf of the client named below, the Department of Health and Human Services authorizes you to provide the service indicated below. This document authorizes you to provide and bill for the listed service in accordance with the units of service, the rate of charge, and the authorization period stated. In providing authorized services, you accept responsibility and liability for injury to client or damage to client's property resulting from negligence by you or your employees in the provision of services. All billings must be received by the department within 90 days of the service provision. Now, at the center of this form, you will see the name of the parent or caretaker and their address. In our example, the parent is Jane Doe. Across from her name, you will find her case number. This also is a computer-generated number and will always stay the same for this parent. You will not have to use this case number on your billing document. Below that is her phone number. Some families will be obligated to pay part of the cost for their child care. If your family is obligated, you will see a statement like the one shown here. As you can see, Jane Doe is obligated to pay her child care provider a family fee of $125. Whether or not the parent is obligated to pay this fee is determined by the family social service worker. It is very important that you subtract the family fee from your final charge. You will see more about this when we talk about the billing document. Now, please remember, changes in the parent's schedule of 10 or more hours per week must be reported to the family social service worker. Also, if a child does not attend your daycare program for 3 consecutive days and the client has not told you they were going to be gone, contact the client's social service worker. Now, continuing on with the form, look at the authorized service area. Authorizations are based on age categories. These categories are infant, toddler, preschool, and finally school age. If you have a family with more than one child under your care, you will receive one authorization for each age category. For example, if you're doing care for one infant and one toddler from the same family, you will receive one authorization for the infant and one authorization for the toddler. If you're doing care for 2 infants, sometimes both children will be on one authorization. Now, there are different service codes for each age category. When entering these on your billing, you will only need the last 4 digits. This example is 8903. Notice the authorization period is July 7th, 2008 through December 31st, 2008. All authorizations must have a beginning and an ending date. This is the only time payment for services will be honored. The parent is responsible for getting the service authorization renewed with their social service worker if they are still eligible to receive services. Now, Susie Doe is the authorized child in our example. Please note only one age category will be shown per form. The client ID number is a computer-generated number assigned to each child. You will use this ID number when billing for services. The client ID number will stay the same for each child. The authorization number is a computer-generated number for each specific authorization. Now, both these numbers must be correctly entered on your billing document in order for the billing to be processed correctly. If you enter a begin date before the begin date on the authorization or after the end date, the computer will reject your payment. In this example, if you billed starting on July 1st, your bill would kick out because this authorization started July 7th. If you use an incorrect authorization number on your billing document, we will be unable to pay you. Now, please pay special attention to these numbers. These numbers are subject to change, so watch for this on all authorizations. What this means is that for any authorizations you receive following the initial one, you may find that the authorization number for the child has changed. When this happens, you will need to use a separate line on the billing document for each of the time periods shown on the individual authorizations. Now, I'm going to show you an example for this when we get to the billing document. The number of daily and/or hourly units shown is for the entire authorization period. Now, as you can see, this authorization is for 140 daily units at $13 per day and 60 hourly units at $2 per hour. The rates shown here are examples only. The child care provider agreement you signed will govern the rates you will see on your authorization. These units work like a time bank. Each time you bill, the computer automatically subtracts those units from the total and leaves you a balance for your next billing. For example, now you are authorized to have 140 daily units total. You billed for 20 days the first month. Now you have 120 days left in this authorized period. This ongoing balance is not provided to you on future billing documents or authorizations, so you will need to keep track of the number of units left on an authorization. Now, it is very important that the parent keeps you informed of their schedule. In other words, specific arrangements for drop-off and pickup times must be established with the parent for each child in care. If the amount of care needed changes significantly, such as 10 or more hours without reapproval by the family social service worker, you may run out of units before the end of the authorization period. If this happens, no payment can be made for any additional units billed. Therefore, confirm with the parent the actual time their children will be under your care. Check this against the provider authorization. And if the units authorized are adequate to cover the care needs, then you will have no problems. If there appears to be a discrepancy, contact the family social service worker right away. Depending on the circumstances, you may see the parent's work or school schedule printed on the bottom part of the authorization. This is to give you additional clarification of childcare needed and time allowed. Below the authorized units are your authorized rates. As mentioned previously, below this you may have a note giving the parent or caregiver's work schedule. In this example, the parent usually works from 9 a.m. to 3 p.m. If the parent works in a regular schedule, it's best to get a copy of the work schedule weekly. Only authorized activities will be paid for by DHHS, plus a reasonable travel time for the parent to get to work and back to the provider to pick up the child. If the parent wants the provider to watch the children while doing other things, such as grocery shopping, the parent is to pay for that time. Now, let's look at an updated authorization. These will be sent to you when there is an increase or decrease in the number of days or hours for a family, or a change in your payment rate. Be sure to refer to the date of notice in the upper right-hand corner and when you receive more than one authorization per family. And remember, the updated authorization is the most current authorization and the one that now governs payment. When you receive an updated authorization, always check to see what has changed. Now, our third type of authorization is a notice of discontinued service authorization. When an authorization is closed before the end of the authorization period, you will receive a notice of discontinued service authorization. Payment for any services provided after the date on the notice will be the responsibility of the parent. You will not receive any notice if services are to stop at the end of the authorization period on your latest authorization. Now, keep these authorization forms in a safe place. You will need the information on them to complete the billing document.